One.
Good afternoon, everybody. My name is Francesca Matias, and I work with the Healthcare
Oh, wait,
Authority.
we're preparing. Now we're
Oh.
live.
Good afternoon, everyone. My name is Francesca Matias, and I work with the Healthcare Authority. During this Facebook Live, we will be providing an overview of the COFA Islander healthcare and dental care programs. Last time you saw Ari and I was November 2019. We have a new COFA program manager, as well as advisory committee members. We'll be covering Apple Health Medicaid restoration, walk through some scenarios you may encounter when using our COFA Healthcare, ways to stay connected, and additional resources. At the end of this presentation, we'll answer questions from the audience, so be sure to comment with your questions while we're talking. Now I'll have everyone introduce themselves, starting with Ariel.
Thank you, Frenchie. My name is Ariel. I work with the Healthcare Authority, and I'm a COFA Islander Healthcare and Dental Care Program Manager.
Thank you, Roz.
Half a day. I'm Roz Leon Guerrero. I work at the Washington Healthcare Authority, and I am the new COFA Islander Programs Manager.
Brenda.
Kumotara Francie. Yahweh Hall. My name is Brenda Kelly. I am a certified navigator for Washington Health Plan Finder, and I'm a Marshallese community health worker at Center for Multicultural.
Juanita.
Hello, everyone. Feranin. My name is Juanita Yasu. I am a school counselor at a middle school. I'm also one of the regional community contractors for COFA Alliance National Network of Washington, and one of the members for the advisor committee for COFA Healthcare.
Thank you. Oh, sorry. Thank you. We're excited to have you both join us for this live event. All right, let me share my screen for the presentation. Oh, can you guys see my screen? Wouldn't be a Zoom meeting if there wasn't something.
Looks like it was at the end of the presentation, so we'll have to go back to the beginning of it.
Okay.
What about now? Awesome. Okay. Oops. So we already went over our introduction and roles. So some of the things we'll be covering today is the Washington Apple Health Medicaid restoration, COFA Islander program overview, some scenarios, how to stay connected, and with resources. And then at the end, we will do a Q&A session. All right, Ari, can you take it from here?
Yes, thank you. So today, just a brief overview. Medicaid restoration was passed through the Consolidated Appropriations Act back in December 2020. This act restored, in addition to a bunch of other things, restored Medicaid benefits to individuals from the Republic of Palau, the Federated States of Micronesia, and the Republic of the Marshall Islands. As part of the restoration, the Healthcare Authority is working on the following. So in Washington, Medicaid is called Washington Apple Health. And so the first thing that we're doing is revising the Washington administrative codes to support the restoration of Medicaid. We're also working on system enhancements to identify and resolve system barriers so that we can support accurate program eligibility. Finally, we're working on community engagement, such as this Facebook Live. In addition to that, we're developing outreach materials. We're partnering with community advocates, and we're sharing information via this Facebook Live, webinars upcoming in May, virtual summits, and social media posts. Just a little bit about Apple Health. There are two main paths to apply for Apple Health. Most individuals eligible for Apple Health will apply for coverage online via Washington Health Plan Finder. That's the single application for Apple Health and qualified health plans, which is what people have with COFA Islander Healthcare. When somebody is enrolled in Apple Health through Washington Health Plan Finder, it is a MAGI-based Apple Health or modified adjusted gross income-based Apple Health. These Apple Health programs determine eligibility based on income limits, household size, and residency, among other things. The other main path to Apple Health are a set of programs called Classic Apple Health. These are programs administered by the Department of Social and Health Services, or DSHS. Individuals that are over the age of 65, are blind, have a disability, or need long-term care services can apply for this Apple Health coverage through Washington Connection. There's also a paper application that people can use. Eligibility criteria for these programs has similar criteria, including household size and income, but it also includes resources. That's the main difference there.
Thank you, Ari. Big changes coming.
Mm-hmm.
Roz, I'm going to hand it over to you for some program overview.
Thanks, Frenchie. There are two COFA programs, the COFA Islander Healthcare and the COFA Islander Dental Care. These programs pay for the monthly premiums and any of the costs from in-network covered services. This could mean a co-pay, which is a fixed amount a doctor may ask you to pay when you go and visit, or a co-insurance, a percentage you need to pay and the insurance company picks up the rest. Individuals enrolled in COFA Islander Healthcare must file their taxes each year because they receive tax credits. Even if you do not have any income, you receive tax credits, also known as advanced premium tax credits, an amount paid to your plan that helps keep your insurance affordable. Tax filing. You cannot file your taxes without the information from the 1095-A form. The Washington Health Plan Finder mails out the forms at the beginning of the year. If you need a copy, you can log on to your Washington Health Plan Finder dashboard, or you may contact the Washington Health Plan Finder. The information on your 1095-A form is needed to complete the IRS Form 8962 and file it with the IRS Form 1040. You may visit the hca.wa.gov/COFA and choose important tax information for COFA Islanders. This website has much information about the programs. There's information how to use the programs, how to use your cards, and if you need to contact us, you will find a green box on the page and can email us directly. Cost sharing cards. These are images of the cost sharing cards. This is known as your Navia card, COFA card, or debit card. The same card is used for health and dental out-of-pocket costs. Each benefit has a monthly limit. At the beginning of the next month, the card is refilled. Please note that the unused funds aren't rolled over to the next month. You may contact us if additional funds are needed. This card can be used to pay for co-pays at doctor visits, medication, or in-service covered services.
And Roz, do we want to let the audience know why there might be two different cards?
Sure. Ari, do you want to help me with this?
Yeah, of course. So as you can see, there are two different cards. The bottom card that says Navia Benefit Solution is the original card. It was issued back in December 2018 when people were first enrolling in the program and was issued until about February 2019. That's when we were able to get our logo on the card. And so people that enrolled after February 2019 will receive the top card. Both of them work. It's the same exact card. You get the same benefits. It's just you'll have different images on them.
Sorry.
Oh, one other thing. So another thing with the image. So it does say debit card, but there's no PIN that is issued. So if people want to use it, swipe the card as credit instead of debit.
Yeah. All right, we have some scenarios we wanted to share. These are pretty common when the program managers see them, but I don't think we've shared a lot of these out for outreach. So the first scenario, I got a bill for my premiums. Maple is enrolled in COFA Islander Healthcare, and she receives a bill from her insurance plan for her monthly premium. She is concerned because she has an appointment next week. Roz, should she pay her bill?
No, HCA pays the insurance premiums directly to the carriers for individuals enrolled in COFA Islander Healthcare. The bill is for her records only.
All right. Scenario 2. Fur is enrolled in COFA Islander Healthcare and went to the hospital. She gave them her insurance information and later receives a bill for $225. Ari, what are the next steps she should take?
There's a couple steps she should take. The first is to confirm that the insurance plan that she has paid their part of the bill. So that could be co-insurance. So if the insurance plan might pay 80% and then FER has to pay 20, but make sure that the services are in network and covered services. The next is that she should just use the cost sharing card to pay that balance. If she doesn't have enough on her card because maybe she got her monthly prescriptions or she had another doctor's bill, she can contact us directly, again, by email or phone, and we can work with her to make sure that she can pay that bill off and not have to make any payments.
Thank you. Scenario number 3. Barry is enrolled in COFA Islander Healthcare and keeps checking his mail for his insurance card and cost sharing card, but they never come. What steps should Barry take? And Roz, I'll hand this scenario over to you.
There are a few steps that Barry should take. One, he should make sure on his Washington Health Plan Finder application that his address is correct. If his address is correct, he should call the insurance carrier to request replacement cards. And then he could call the healthcare authority to request for the replacement of his cost sharing cards.
Thank you. And I believe this is our last scenario. Oak enrolled in a qualified health plan that starts April 1st and is approved for COFA Islander Healthcare. She goes to the doctor on April 4th and tells her doctor she has COFA, but the doctor says she doesn't have insurance. What are her next steps? And Ari, I'll hand this scenario to you.
Thanks, Frenchie. So instead of saying that Oak has COFA, what she needs to tell her doctor is which qualified health plan or insurance plan she has. Again, that's the one she chose probably during open enrollment, could be Ambetter, Molina, Primera, one of those, and make sure that her doctor takes that insurance. COFA Islander Healthcare is not the insurance. It's the program that pays for the insurance. And so, yeah, she needs to tell which plan she has. If a doctor tells her that her insurance plan is not active, she can contact us and we can help her work through that.
Thank you, Ari.
Mm-hmm.
So now we would like to share some resources. The first one being COVID-19. The links below give you some information on COVID-19 and how the Healthcare Authority has responded for Apple Health eligibility. And then we have our COFA Islander webpage at hca.wa.gov/COFA. Email us with any questions at COFAquestions@hca.wa.gov or call us at 1-800-547-3109. We also like to encourage everyone to sign up for GovDelivery. You can sign up via text or email, and it will give you updates on COFA Islander programs or other Apple Health programs you'd like to stay updated with. Follow us on social media. This is where Facebook will have this live video posted on Facebook, and our other social media sites. Q&A session. So I believe some of our advisory committee had questions. We want to start with them.
I can go ahead and get started. So the outreach materials and presentations, webinars, will they be available in the COFA languages?
So we do currently have outreach materials available in the COFA languages on our website, dedicated to the programs at hca.wa.gov/COFA. The presentations will be posted on YouTube and Facebook for viewing after this is done.
If they call the customer service line, the 1-800 number that is in the presentation, will they have access to interpreters in the COFA languages?
Thanks, Juanita. Yes, they will have access. We have access to interpreters in the COFA languages and will be able to get interpreters to help them.
What kind of documentation or information would you recommend for them to have in handy before they call the 1-800 line?
So there's a couple of different scenarios here that I'm thinking about. So the first scenario is somebody that has COFA and is calling to ask questions about their COFA Islander healthcare, their COFA Islander dental care, things like that. So what we would need is a way to look them up. So we would need their name, date of birth. If they know their Washington Health Plan Finder application number, we could use that. Their social security number, if they know it, we can take a look and find them there. The other scenario I'm thinking about is people that have not applied yet. And so the documentation that is needed there is a little bit different. Actually, I'm going to hand this off to Brenda so that she can kind of talk through what she recommends people bring with them when they're newly applying for the programs. Brenda?
Thank you, Ari. Okay, to apply for Qualified Health Plan Finder, which is the COFA also, you will need your passport. It's one of the most important one, the passport, because that's where it shows that you are the citizen of the COFA Highlands. And also your I-94 and also your social security card. Sometimes we have our passport that they're expired, but you still bring it in and we'll take the number because that's the most important thing is the number. And then we'll give you 60 days to 90 days to get the updated or the new passport. And then we can change it from there. But those are the three main important ones.
Thank you, Brenda.
Do you need more questions from advisory from the community? So
we have 8 in the chat box, but if you have more questions, feel free to ask.
Yeah.
Okay. For our communities, what is the meaning of the word carrier or the plan? What does that mean?
Question.
So, okay. So carrier or plan is just the term for the insurance company that you pick. So when you apply for Washington Health, in Washington Health Plan Finder, there are different carriers. So one example is Ambetter, another could be Molina, and then they could have multiple or many different insurance plans to pick from. So the carrier is just the big umbrella term for insurance company.
Okay, and which plan that we're on? If we're gonna, let's say we choose Molina, what plan that we should pick?
So when you submit your application, you will need to pick a silver level plan. And that's just a term for a type of insurance plan in the exchange or on Washington Health Plan Finder. And so when you are eligible for COFA Islander Healthcare and you go to pick a plan, all of the plans that you can get and that COFA Islander Healthcare will pay for will show a $0 premium. Normally, if you didn't have COFA and you're just, if I go and apply, I would see a dollar amount for each plan. When you are eligible for COFA Islander Healthcare and COFA Islander Dental Care, you will see $0 amount due for each plan. And in addition to that, you'll see the little logo for the plans as well, so that you get 2 indications that that is the plan for you.
Also, what do you mean when you say in-network?
So in-network means that your doctor takes your insurance. So they can bill your insurance and be paid by your insurance company for the services they provide you.
Thank you.
Mm-hmm.
Do
you
we
have
want
any?
Oh, sorry.
I'm sorry. I was going to ask about the COFA Highlander health card. So you said this one should run as a credit card and not a debit card. Okay, and with the card, do you pay for the co-payment for dental and health both, right?
Yes. If you have both, you can use the card for both.
Okay.
Yeah, you will get one card for both benefits.
Okay.
Would we like to answer some of the audience questions? We have quite a few coming in. It's exciting. Okay, first question. Clients received a bill in the mail. How do clients know these are already been paid? Also, what about clients that are under COFA but paying for out-of-pocket versus out-of-pocket for some costs?
Okay. Roz, do you want to answer?
We can answer it together.
Let's answer. Let's do it.
Yeah. So clients receive bill in the mail. How do clients know these are already been paid? One, you could call the healthcare authority and we can verify if they've been paid. It would also list on the billing what has been paid. Ari, do you want to elaborate on that?
Yeah, so I'm thinking so you can get a lot of different bills in the mail, which is kind of unfortunate, right? So when I'm thinking about bills, the first thing I think about is the monthly premium bill. And that is something that we tried to stop for people that have COFA Islander Healthcare, but just due to system issues, it wasn't a possibility. So when somebody gets a bill for their monthly premium, and it should say that right on the bill, that is a bill that we take care of for you. So you do not pay that bill, that we pay that for you when you have COFA Islander Healthcare and COFA Islander Dental Care. The other bills that you can get in the mail are bills from either the doctor or you had to stay in the hospital, you went to the emergency room, you could get bills like that. So the first thing you want to do there is think, did I already use my COFA card, my debit card, my Navia card, however we want to call it today, to pay this bill? If the answer is yes, and you're receiving a bill, you would probably need to call whoever is billing you and ask why you're receiving a balance due, since you think you already paid that bill. Some doctors pay or bill you after. And so it's just a matter of making sure that on that bill, you can see there's usually a column that says like insurance payment, and it'll say how much they paid. And then you can see that you're left with, say, I'm going to make up a number, $100. And so then that's the amount that you would use your COFA card for. And you can just, whatever payment options they have, you can give them a call and get that bill paid.
And it's a two-part, and
Yeah.
clients are under the COFA programs, Islander programs, but paying from out of pocket for some cost. If you paid for out of pocket, you could, one, Navia has created an app that you could download, and you could submit your receipts on that map for reimbursement, or you can call the number on the back of the Navia card, and a representative can help you process the reimbursement.
Yep. The one thing I would say to that is if you go to a doctor that does not take your insurance, or you get a prescription that is not covered by your plan, you cannot use the Navia card for that. So you could be paying out of pocket using your own money in those two scenarios.
All right, question number 2. Will this presentation be available later in COFA languages? For example, could it be available via subtitles or subtext, Marshallese, Chuukese, Palauan, Yapese, or Pohnpeian? Good question.
Thanks, Frenchie. We can take that back. At this time, we had not planned on getting this presentation translated, but again, it is available or will be available on YouTube and the Healthcare Authority Facebook page after we're done here.
So we'll update everybody if it can be translated. All right, question 3. Is there a limit on the COFA benefit card, and could it increase when a member received a bill that is more than the limit? What is this process?
Each month, the card is refilled at $300. If a member receives a bill that is more than the limit, the member can either email us at the COFA questions at hca.wa.gov, or can give us a call, and we can help the member add additional funds to their card.
All right. Next question. When will eligible members from the COFA community be able to enroll to Apple Health? If a member is already enrolled through the marketplace and is eligible, will they be auto-enrolled to Apple Health?
This is a great question. These are things that we're thinking through as we implement the system changes that we talked about earlier. The one thing I can say is continue to apply. Apply online through Washington Health Plan Finder, continue to submit your application, and sign up for GovDelivery. We are sending consistent updates through GovDelivery to make sure that the community knows what is going on with the implementation of Medicaid restoration.
All right, thank you. Next question. How often do benefit cards get funds transferred?
Monthly.
Monthly.
And if they didn't use it, it just rolls over to the next month.
Yeah, yeah, it doesn't add up. So you
No,
don't end the
up.
year with $3,600 if you didn't spend it at all. Yeah.
All right. Next question. How will we know which plans are under COFA Healthcare?
Yeah, so Roz, do you want to take that one? Or Brenda? Brenda, you work with the COFA community. Brenda, how do we know?
How do you know when the plan is in COFA?
Mm-hmm.
Because you got that logo, it shows COFA Highlander, it shows on the plan. So that's the cue there. If you don't see that logo, you know that you're going to pay for it. So make sure you see that logo. Or you can call me at work to verify.
Thank you for that offer, Brenda. I'm sure you'll get your phone will be ringing off the hook very soon.
Okay, next question. And I'm not sure what this abbreviation is. So do we have CHW to do outreach events? We need several in each community based on number of COFA members.
I think that's community worker.
Community workers?
I think.
Okay.
Yeah, it doesn't.
CW.
See, okay. So again, we're working on our community engagement plan to make sure that the communities know throughout the state that Medicaid has been restored, and that if they have COFA Islander Healthcare, COFA Islander Dental Care, what their benefits are. Again, that includes social media posts, this Facebook Live. And so, you know, it's a little tricky with the way things are right now, but we'll definitely take that idea back and see about our community engagement plan.
Some great questions coming in.
Mhm.
Okay, next one. How quick or long of a wait is when someone calls and needs access to language support? In addition, what is the requirement to apply online via Health Plan Finder or Health Connection? I wonder if they meant Washington Connection?
It should be Washington. It should be Washington Connection.
Washington Connection.
Yes,
Okay.
yes.
Okay, so there's several different questions here. So how quick or long of a wait is it when someone needs access to language support? So when somebody tells us that they need an interpreter, we immediately get that interpreter. And if somebody has to leave a message and they can let us know if they need an interpreter, we can call them back with that interpreter and have them on the line when we connect with them. What is the requirement to apply online? I'm not quite sure what this question means. You don't have, so here's the thing. There are multiple ways to apply. You can apply online. It is the fastest and easiest, but we understand that some people don't use the internet, don't like to use the internet, have a hard time getting through applications. And so there are multiple ways. So there are people like Brenda that are navigators that can help people process their applications online. There are paper applications. So if you just want to fill out a paper application, it's the same information that you would enter into the online application. You can write that out and send that in, and that will be processed. There's also, for people that just have smartphones, there is an app for Washington Health Plan Finder. For Washington Connections, I think you would still have to use your internet browser, but you could probably still use that on your smartphone. But again, through Washington Connections, so that would be for people who are disabled, who need long-term care services, are blind, or over 65. There are paper applications and people that can help you fill those out.
Thank you.
Yeah.
Sorry.
I was trying to think about what else to talk about with. Yeah, go ahead.
Can I add something? So I think they also need to create an account. And they also need an email address in order to create that account.
Yes, good call out, Juanita. Yes. Yep. And then that's another thing. So when you create that account and you have an email address, that is one option in Washington Health Plan Finder. So if you don't want to get mail, I'm going to call it snail mail, but letters mailed to your home, you can, once you have an account and an email in Washington Health Plan Finder, you can sign up to receive electronic notices. So then instead of waiting however long it takes now to get a piece of mail, you will be notified via your email so that you can go back into your application, log right in using your account information, and read that letter.
Thank you. Next question. Will the Washington Apple Health restoration also increase the income guidelines from 133% of the federal poverty level to 138%? Someone? Anyone?
Ross, do you want to take it?
So with the Medicaid restoration, it is with the guidelines of the federal Medicaid federal guidelines. of Medicaid. So it does increase from 133% to 138 FPL. Correct, Ari?
That's correct. Yeah. So COFA Islander Healthcare, the limit is 133%. That translates into dollar amounts. I know that the income limit just changed, so I'm not going to quote any numbers here. So every year the federal poverty level changes and our income limits change, or the dollar amounts change with that, but it's always the same percentage. So for COFA Islander Healthcare and COFA Islander Dental Care, it's 133%. With Washington Apple Health, there is an added 5% for Washington Apple Health for adults. So you get that little bump up to 138% of the federal poverty level.
And to see the current COFA Islander Healthcare program limits, they're on the COFA website.
Okay, Ari, that went over
way
my
overhead,
head.
way over.
Yeah, 138% does go over my head. So
Yeah.
can we? I mean, it's not going to be exact number, but
no.
can we put it in the numbers? No.
Yeah.
Like
okay.
1,300 for 2 people.
Yeah. So let me.
I have the COFA Islander Health the page up. Here, let me share my screen.
Okay. And I'll get to a spot here, and we can talk about that a little bit. That 5% difference.
Okay.
Okay, so do we see the income standards on the COFA website?
Yes.
Okay. So, and this is for the current program, the 133%. Yep.
Yeah.
Okay, so that's my language. That I understand.
Yeah. Okay, so for example, okay, so this is, let's get back here. So this will be a little bit different in terms of numbers, but here you can see that I'm going to tell you some differences here. So for a household of 1, for the new adults, so Apple Health for adults, that is with the 133%, $1,428. This is for Apple Health. COFA Islander Healthcare income limits change at different times. So that's the one thing here. So 1428, 133%. 138 is 1481. So there's a little bit of a difference. The great thing here is you don't have to think in your head, okay, let me convert it to a percentage of the federal poverty level. What is my income as a percentage of the federal poverty level? So the great thing about Washington Health Plan Finder is you just go through the application and you put in your income. There's even an income calculator. So if you don't know how much your monthly income is, you can use an income calculator and enter how many hours a week you work and what your hourly wage is, and it will calculate that monthly income for you. And then once you submit that application and you put in all of those details, like your passport, your I-94, all of those details, whether you're pregnant or not, if you have other income, once you submit it, it does a little calculation, says, okay, yes, you're eligible for this. No, you're not eligible for this. It will tell you immediately what your what you were eligible for.
All right. Next question. How long do clients have to wait after being qualified for COFA Islander Healthcare to receive their benefit card and their insurance card?
Go ahead, Rob.
Once they receive their eligibility letter and they select a plan, they will receive the benefit card or the cost sharing card and their health insurance card before the start of their plan. So currently those that are enrolling in COFA Healthcare and Dental Care, their start date is on May 1st, depending again on their eligibility, when the start of their eligibility. Most are starting on May 1st. They should be receiving it before their start date. So I would say about a week before. I've heard folks receiving it, clients receiving it a week before.
Just a few more questions to go. The next one. Would a letter from the COFA consulate general offices or embassies be sufficient as a governmental form of identity or citizenship? A verification letter to get qualified for these medical programs?
I don't
Good
think
question.
I've seen one of those, when I'm thinking about the Washington Health Plan Finder application, again, because I think that's what most people will apply for Apple Health and COFA Islander Healthcare through. You can say, it will ask you if you have an immigration document. So that could be an I-94, an employment authorization card. There's several different options. I think you can, I'm trying to remember. I think at the very least, if you say, it depends on, so I'm trying to think about the application. So if you say you have, say, an I-94, the next thing you'll say is, what's your I-94 number? If you say you have an employment authorization card, it'll ask for the information from that card. So there's specific options in the application. You might be able to select other, but it will ask you for some information on that form. If you don't have an immigration document, because I know I-94s, they went virtual a while back, it will ask you, do you have a foreign passport? And so you can say yes or no. Again, as Brenda said, if it's expired, totally fine. Enter what you have. And then it could, once you submit the application, ask you for more information. You could be sent a letter saying, please provide proof of your status, but you would get a letter with that request.
Yeah. Good question, though. I don't know if I've ever seen that consulate letter.
No.
Maybe now we will.
Yes.
All right, next question.
COFA always come up with different
things.
Okay, next question. So if clients used their own money to pay for some bills that was supposed to be paid by COFA, can they send receipts for reimbursement, excuse me? And if so, where do we send it to?
Yes, they can. Again, Navia has an app that they can download and submit their receipts on there for reimbursements, or they can call the number behind their Navia card or their cost sharing card, and a representative can help them with the reimbursement process.
Thank you, Roz. Just a couple more. So what do we foresee that the HCA COFA team needs in order to strengthen the outreach, education, enrollment, and usage of the health benefits? This is a couple questions. And how do you encourage members to use their benefits, and for providers to better understand the generational health disparities that is unique to the COFA communities?
Okay.
I
There's a
can
lot
repeat
here.
the second question too, if you need to.
I think for one, I would say the Facebook Live is a clear example of what we are doing to strengthen the outreach, education, educate people on the enrollment and the usage of the health benefits. I think it's very beneficial to have both two community members on the COFA advisory committee with us. It's very, I think the questions that they have asked, these are questions that the communities have reached out to them. So one, we can continue to do this outreach. I think it's very important that we also include language access, and that's something that HCA has been looking into. Like Ari said, we will bring it back, and we will try find ways to help convey messages in languages, in the different respective COFA languages. I think we will, aside from the Facebook Live, we also have a webinar that we hope everyone would with these questions will help build the webinar, the content for the webinar with the questions from this Facebook Live. This will help us increase again the outreach education on the enrollment and the usage of health benefits. We are encouraging members to use their benefits when clients call us and they ask for assistance and support. You know, we let them know that they have these coverages. They have their healthcare, they have their dental care. We also help them navigate on how to use these benefits, you know. So I think with these, with the Facebook Live, with the upcoming webinars, and also with the partnership of our COFA advisory committee members out in the community, I think it will help strengthen the outreach. Ari, do you want to add more to that?
No, that was very well said.
Can I add something? This is Juanita.
Of course.
So thank you, Ross. I think one thing that I would like to request from you and Ari and your team is if we could have these webinar presentations be available in the several languages, because I believe this is really good information, especially for our community members who also are not able to understand English. And to answer the second question, and this is really for my, the community, the COFA community members, I would encourage us to utilize the benefits. And what I mean by that is not only use it when we have emergency, but to try to get more preventative services so that we can inquire about our health, we know what's going on with our health, and we can prevent illnesses or diseases in the future.
We're all nodding in unison. It's a great point, though. It's something we
Yeah,
do
it
want to
is.
promote, and it's more than just emergency, it's preventative as well. One thing I want to add, which I don't think we covered in the presentation, is we have Share Your Story available. It's done for Medicaid. We have it for COFA. And so if a recipient of COFA Islander Healthcare shares a story how the program has positively impacted them, we would use that for promotions and put it on our website. And then the recipient of COFA Islander Healthcare could get a $50 gift card. So we haven't gotten a submission yet. We're still hoping it's still available.
Well, I already asked 2 of my clients to share their story with you guys.
Oh, so, awesome. Send it our way. Yeah, send it our way.
And they're good testimony. Can I ask one more question?
Absolutely.
Okay. I don't know if this is for us, but I just want to ask because we're having kind of problem with it. You know, we're supposed to file tax, right? And you guys just explained that it needs to go with the other 2 forms. But then they get to the filing tax offices and they tell them that they're not supposed to file tax because they're not paying the premium. Or so where is this information coming from, and what is the correct information that we should know?
You know, I'm not sure where that's coming from. They do need it. It's not about the premium to the carrier. It's about the tax credits that they receive. So it's the money that the IRS is giving the insurance plan to help pay for the monthly premium. And so that is what needs to be included in the tax return. They receive a 1095A. And so it could just be a reminder that, you know, if they're going to a tax preparer to, you know, unfortunately advocate for yourself and say, I received a 1095A, I have to file, you know, please help me complete this form. I have to file this way.
Okay, I guess it's my assignment to do it with one of my clients, so we
Oh,
can know
no.
the answer.
We did. So the other thing, Roz mentioned that we have a informational sheet about this whole process of filing the taxes. And so on that page, which again is translated in the 6 languages, we can, there are free resources to help with tax filing. So you can also visit hca.wa.gov/COFA, find that tax filing form, and then there are free tax filing resources that can help process those forms.
Okay.
So I did get a message saying we have about 10 minutes left. Last question in the chat. How will clients know when their coverage transitions from COFA Islander Healthcare to Apple Health? And will they need to take action?
Okay, how will clients know? I just have to read the question again. How will clients know? So for most people, they will transition through Washington Health Plan Finder, and they will receive a letter that says their COFA Islander Healthcare is ending because they have Washington Apple Health. That will be the process there. They may need to take action if they are over 65, have a disability, need long-term care services, or are blind, because there are programs that are through DSHS that use a different application process. And so to apply for Washington Apple Health for those services, that is a separate process, and you will need to take action through Washington Connection or through the paper application.
All right, anything else before we start to close out?
I just received an email from one of the community members watching the live. The question is, my I need to have a surgery, but they're not accepting my insurance. How can she proceed with this one?
I'm sorry, Juanita, can you repeat the question one more time?
So she needs to have a surgery, but they are not accepting her insurance. What
Okay.
should she do?
Here's a couple of things I would recommend. One, call the insurance company to see if they can work with the doctor that will give the surgery. Or two, I'm sure that she was referred somewhere else. So see if she can go back to the doctor to see if she can, if she needs to work with the doctor to see if they can take the insurance or if they need to find a different surgeon.
And I have one more. I think it's a very important question. When is normally the open enrollment? And is there special enrollment? Because, with the COFA community, we're always migrating to US. Is there a certain special enrollment period for those people that just come to the United States from the islands?
And just raising your hand. Yes.
Yeah, I'm so happy to say that because we, the COFA, we are so lucky because we can enroll anytime you come in. And that's the thing about the COFA health plan or health plan care, because it's really flex for us. You come in today, tomorrow you can apply for health insurance. And not only that you apply, but you get it free, basically. So we have open enrollment, which is from November 15 to December 15 for Washington Health Plan Finder. But then we COFA, you can enroll anytime. And we don't have any limitation like other countries that they will have to wait 3 years or 5 years to enroll. But us, you can enroll anytime. And that is a plus plus.
Yep. And then the other thing that I want to mention briefly in terms of open enrollment and special enrollment is after the Apple Health transition is complete, there is no open enrollment or special enrollment period. You apply anytime. So that's the one difference between a qualified health plan and COFA Islander Healthcare is there's generally a specific amount, period of time at the end of the year that you pick your plan for the next year. Apple Health, you apply anytime for year-round coverage. So that's one of the differences that will be coming.
Okay, now that we bring up the Apple Health, I have another question.
Yes.
Is it gonna cover dental and vision?
Yep, medical, vision, and dental.
Thank you.
Yep. Frenchie, I think you're on mute.
I went the whole live without doing that. And
So
of course,
good.
at the end. Any last questions, comments, anything else we want to do before we close out?
Yeah, I did just want to say thank you so much to Juanita and Brenda for taking the time out of their day, out of their very busy day, and joining us for Facebook Live. And I just do want to say that we will be exploring translating these presentations in the languages. So thank you very much.
Yeah, and repeating what Ari says, thank you both, Juanita and Brenda. So for anybody watching, thank you for all your questions. If you visit our webpage, hca.wa.gov/COFA for important information on the COFA Islander programs and the restoration. If you need any assistance with your application or need help with your health coverage, you can call us at 1-800-547-3109 or email COFA questions at hca.wa.gov. We survived. We're done. Have a good evening, everybody.
And if I could say, please be safe, mask up,
Yes.
and practice social distancing.
Yeah.
Thank you.
Thank you. Bye-bye.
Thank you.